Well said.
Okay.
Hello and welcome to those who are joining us for the first time, and welcome back to our course, One World, One Health, One Medicine. I am Satish Bidesi, and together with our students, we hope to interest and excite you on the topic specifically of One Health and One Medicine. Throughout this course, we will have discussed the concepts of One World, One Health, One Medicine, and the different facets by which these principles can be applied. Today, specifically, we will be exploring the actual application and practicalities of how human health and animal health can actually come together. I personally feel very proud of the effort, and indeed our students as well, as they demonstrate the principle of One Health and One Medicine. Joining us in our seminar today are two of our students, Elon Armstrong, a dual degree student pursuing both veterinary medicine and public health, and Judy Wong, a medical student also pursuing public health. So they're very ambitious, they're very hardworking, and very much part and parcel of the scholarship that we offer here at St. George's University, actively involved in community service. So we're in the month of June. That means we're halfway through our course, and we trust that you are enjoying it thus far. And when I think of halfway, I always think of a song that comes to my mind. We are halfway there. Whoa, hope we're not living on a prayer. Well, I don't want my students to be embarrassed of me, so I think I'm going to cut that short right there. But certainly allow them to share with all of us what they do in the communities here in Grenada, hopefully with applications to wherever you are in the world. And after their presentation, we will continue the conversation and look forward to your own thought, your own ideas of how human and veterinary medicine can get together. So welcome to the session once again, and I'll take it over to Elon and Judy.
Thank you. All right. Hello, everyone. Thanks again for joining. And as Dr. Bidesi mentioned, my name is Alon Armstrong, dual degree here at SGU. I'm pursuing my veterinary medicine degree along with a master's in public health. And I'll be getting ready to start my second year this fall. And I'm currently staying on campus for the whole summer doing research.
And good morning, everyone. My name is Judy. I'm a second-year medical student at St. George's University, currently in term 4. I'm a couple of weeks before finals, so I have until the end of this month, but I'm happy to be here with everyone today. And today we just want to talk a little bit about some of the student organizations that we have on campus here that actually do community outreach opportunities for students. Give us 1 second.
I got it.
Okay. Oh,
And I'm going.
Okay. Okay. And so I'm part of the SGU chapter of the American Medical Student Association. We're just a collective group of students that come together to put on health fairs around the different parishes in Grenada. Other things we also do are fundraising events for the Grenada Heart Foundation, Dove Foundation, and recently we've also restarted the blood drives on campus to hopefully help out the General Hospital in Grenada whenever they're short on blood supply. We also hold other student events throughout the term, like Med versus Veterinarian School volleyball or a dodgeball competition. And hopefully for next semester, we bring a little bit more to the table for everyone to get more involved. And
Okay. So since today we'll be discussing One Health, One Medicine community clinics, I just chose 3 organizations that are heavily involved in putting everything together on the veterinary side. The first one, I have SCAVMA, which stands for the Student Chapter of American Veterinary Medicine Association. Then there's VPH, which is the Veterinary Public Health Committee, and then of course MiniVets. So I'm going to start talking about MiniVets first because I find that it's a very, very special initiative as it targets children and educating them through various lectures and just any kind of community outreach put together for them. That it's in a pretty well package form that's easily digestible for them. So their initiative is to educate them on ethics, animal nutrition, animal behavior, all those things that apply to them, and it's really within the context of Grenadian culture and Grenadian law as well, especially as it pertains to animal welfare. So it's a really, really wonderful initiative, and oftentimes when we're planning these sorts of, especially as it turns health, we oftentimes overlook children, and we have to remember that as cliche as it sounds, children are our future. So whatever work that we're putting in now, we want to make sure that it's being carried on as time goes on. So other things that that these organizations provide are events such as wine tasting and silent auction, and actually that is that is run by Reagan Schwartz, and she recently did a seminar for you guys. But she's wonderful, and so she'll put these events together, and I think it's pretty unique because she not only shares her fantastic taste in wine, but she does a great job at getting community involved as well. And so it's a chance to let everyone know what's going on, and for those who, if anyone knows of people who could use services like, such as what the health fair provides, it'll be a great way to get that out there. So SCAVMA is an organization that they're pretty much the backbone for us veterinary students, and they're very, very supportive. And oftentimes, no matter what it is, they'll try to do fundraisers to help us obviously get the money that's needed to get these things going. And recently they worked on a project, and it's called the Green Consortium. And basically this organization that's been recently reinstated here on campus, and what they have been able to do is focus more on the environmental aspect. So they try to raise awareness on environmental health, and I think that's so important as we are discussing, the whole concept of one health, one medicine. It's not just humans, it's not just animals. We have to take into account the environment as well. And even though they're in their infant stage, it'll be interesting to see as time goes on what can be done in the future as it pertains to these community clinics. Their involvement with that. And I just want to send a special shout out to Veterinary Public Health Committee, because they are really the motherboard behind these clinics. They do a wonderful job at organizing everything. It's a lot of hard work, but they do it, and they do it well. So at these clinics, we do have student veterinarians involved, and they work under the supervision of licensed veterinarians who are usually faculty here at SGU, so it's very important. And throughout the term, there will be random student events that are put on to, again, raise awareness and raise funds to get these things going. And typically, we have about 2 health fairs per semester.
So just to give everyone a brief information about what Grenada looks like, we have a picture here just showing you some outlines of certain parishes that we actually go out to. So the main ones are the 6 that we've listed here, and we also have associated islands. Carriacou, we last went about approximately a year and a half ago. We really want to go out there for another opportunity, but we haven't been able to do so just because of time constraints. So we're currently located at St.George Parish, which is south part of the island. What we've noticed from going out into the community is that the need is more based up north on the island in St. Patrick, St. Mark, St. Andrew. That's where we found lots of community members actually come out to our health fairs, more so than down here where some of the needs are better met. And just to give everyone a little summary of how these health fairs started. I was talking to Dr. Subarao. He's one of the founders of these health fairs that started in 1994. He worked on it with Dr. Friday and other licensed physicians on the island at that time. They were part of a group starting in St. George's University, and they went out to the Carenage area in St. George. And they basically held these health fairs a couple times a year, and they found like lots of people are coming out, and that was mainly due to health care workers shortage in the local community health centers. We'll talk a little bit more about the perception of the reception of the community members, but we just wanted to tell you that for the medical human aspect, the clinic started in 1994, but the One Health, One Medicine health fairs, where we both partner up together, really started around 3 years ago. And Alon will talk about the person who founded that idea.
Okay. Okay, so yes, the founder of the O-Home clinics, we'll refer to them as O-Home because it's easier. So her name is Dr. Brittany King, and she's class of 2010. She did attend St.George University. She is a wonderful individual. I did have the pleasure of meeting her a few months back when she came to visit campus. So what she did during her time here was basically organize these clinics. She put them together, and throughout her time she's done a lot of fundraising for not only the animal health initiatives but humans as well. And I don't believe she got a degree in public health, but it would be great if she had. But the fact that she was able to do that without the degree is just volumes. So knowing that you have this degree, just knowing the things that you can do, she definitely sets the pace for that. So the things that she's done is she's gone across the English Channel. She's run 7 marathons over 7 continents in 11 days. She climbed Mount Kilimanjaro. She's done Ironman triathlons, and all these things she's done with the purpose, for the purpose of fundraising to raise awareness. So I think that's incredible. And if she hasn't already done enough, in her free time, she enjoys to pilot airplanes, and she's just an incredible human being all around. And she's currently in Houston, Texas, if any of you guys are out there.
Okay, so like I previously mentioned, back when the health clinics started, a lot of the licensed physicians came out to the health fairs to actually see the community members. However, over time, a lot of the physicians actually went to private practice, and lately we haven't had as many volunteers for these clinics. So right now, it's more currently run by the students and the clinical tutors from the school. And AMSA is just a small part of what we are at these health fairs. Lots of other student groups come out with us. AMSA provides the general screening. Women in Medicine also comes out, and they do free breast screening, and several other groups like IFMSA, SCORE, just like a little shout out to everyone, and neuroscience, and CAPIZA. All these little groups are the patient education groups, and we can't put on these health fairs without everyone's help. It's a great learning experience for all the students, and also for the community members that actually come out. They're really happy to actually converse with us and see that we're actually interested in helping them learn how to help themselves as well. And we'll talk about certain challenges in a little bit, but it has been a great opportunity for a student, for myself at least. I've been involved in AMSA since I've gotten to Grenada, which is like almost 2 years now. I've been to most of the health fairs, at least 10 or so and more, with other associations, and I believe that we do have an impact, whether it's just talking to them, talking about their health needs, what they would like to hear, basically, and why they don't like to go to the health community centers versus coming out to our health fairs. And would be the same for the veterinary side as well.
Right. So for us, and if you guys are ever wondering how do you get students involved in these things, well, for our side, typically the Veterinary Public Health Committee will hold lottery sessions for the students, and because it's somewhat limited, we kind of have a cap, but we get as many students involved as possible. There's always a desire for veterinary students to participate, which is a wonderful thing. And as I've mentioned before, the veterinarian faculty is usually on board, and they're more than willing to help and make sure things are running smoothly, that treatments are going, appropriately, etc. So they're there to supervise us. And essentially, so unlike the medical side where you have different groups like the neuro group and women in medicine kind of doing different things, on the veterinary side we tend to kind of ball everything together, if that makes any sense. And we still make sure that the animals get what they need. We make sure, which we'll go into later as far as the services provided, but we make sure that the clients are educated. It's pretty well-rounded, and if there's anything that's beyond a student's scope as far as what kind of topics to address or any kind of health issue that's noticed, the veterinarians are on board to take over.
Okay, so here are just some pictures of what we offer at these health fairs. These health fairs are held at locations where NGOs and certain church groups kind of volunteer their site for us to use. And that can vary from different schools to different community centers as well. So a lot of these health fairs are held in place of elementary schools or high schools. So in these settings, you can see these pictures. We're using like classroom tables, and you see like a blackboard in the background. But basically what we have patients do is come and meet with one of our students to do a patient history questionnaire. We take down any concerns they might have, and basically also advise them on certain lifestyle changes, any dietary changes as well. A lot of people come in with hypertension or diabetes, and a lot of people complain about vision problems, and a lot of them don't realize that some of these other things that they do might be affecting that part of their life. And so after the patient history taking part, we do have basic screening. We have blood pressure measurements, we have blood glucose level measurement, and if they're female, we'll ask them if they would like a free breast exam, and we'll send them over to Women in Medicine. We also do some vision and hearing screening. At these health fairs, we don't prescribe anything. We don't have enough of the licensed physicians to offer that part on our side. But it is still great to have students pair up with our clinical tutors who will then see the patients to address any concerns they might have. The top ones, like I've already mentioned, are concerns of hypertension, diabetes. But sometimes people have ulcers on their foot due to gangrene or fungus that's growing, and we try to kind of advise them to do more home remedy things that can hopefully treat their fungus, or also just refer them to their physician, or for ultrasound or MRI, anything that they might need. Just to point out some of these pictures on the top left, we have students here checking blood sugar. Bottom left, we have hearing testing, Weber's test, if anyone knows. And then on the bottom right here, we have blood pressure measurement as well. So AMSA is not the only group that actually helps us out. We have the nursing student actually come out and help us as well. They do take on large part in just helping out the students as well. In the bottom right picture here, the students in the gray shirts, they've been great at our health fairs as well. And another group that actually comes out with us is the SGU Pediatrics Club. So we do separate between the adults versus children, and this group tends to the needs of the children more. They're more playful. They offer stickers a lot of times, and they're more interactive, and they get to talk to them more about dental hygiene and healthy eating as well. And just to give a brief on veterinary medical services.
Yeah. So on the veterinary side, it's essentially the same thing. There are health exams that are offered, and they're quite thorough, and they're needed before anything else can be done as far as vaccinations, etc. So during these health exams, vision is assessed, hearing, if there's any kind of leg injuries, and that is a common thing on the island because there are a lot of dogs, whether, even if they're owned, they're still free to roam, and they oftentimes get hit by cars. So they're usually not tended to, and so if that's the case, we assess to see if there are any old injuries or even fresh ones. So during the process of health exams, we use that as an opportunity to educate clients along the way. So anything we find, we'll just let them know, and we'll let them know why it's important that they attend to it. If there are any fleas, if there are any ticks, those sorts of things. If the abdomen is being palpated, oftentimes if it's like a pot belly sort of thing, especially in a puppy, that's usually indicative of a parasitic infection, so internal parasites. So we tend to just look out for those things and make the client aware as much as possible. So vaccinations that are given, the primary one is rabies, of course, because we still have an issue on the island with rabies. Again, basic treatment plans. So I'll give you a special case that I heard from a student. There was a client who brought their puppy in, and they said that they think the puppy is deaf, wasn't responding to any sound whatsoever. And upon examination, they found that the puppy wasn't actually deaf. In fact, it had ticks, so many ticks, to the point where it's clogging the air canal. So once they took their time and they removed the ticks, of course, just like that, the puppy was starting to hear again. And so those are the sorts of things that go on. And as far as client education, it's not merely you must do this, you must do this, you must do that. One special thing with these clinics, wherever you are in the world, you have to take into account culture. So because majority of the students who are doing these clinics are American, we know that in the States they're a bit more responsive to certain things when it comes to pet health because they consider them a part of their family. So if the veterinarian says jump, the owner says how high. That's usually how it works for the most part. In Grenada is a little bit different, so we try to keep that in mind when we're communicating with our clients. And I think one important thing to do as far as strategy is to make a connection to human health. So if you're talking about tick infestation, it's one thing to say you need to keep your pet on flea and tick preventative, and they'll say, okay, well, what's the point? I can just remove the ticks if I see it, blah, blah. Well, no, not only will your animal be at risk of contracting, pretty bad diseases associated with these insects or pests, but you're also at risk. So if your dog is attracting these ticks, then there's certain diseases on the island, such as Ehrlichia, that are zoonotic, and once you're infected, it can have pretty grave consequences. So once you make those zoonotic-like connections, I think you have a greater impact and a greater chance of not only them taking care of their animal, but themselves. And we'll discuss this later, but all home clinics tend to do a pretty good job at referring clients to either side. So on the veterinary side, we'll say, you know what, how about you go talk to the medical students over there, they can give you more information as far as this is concerned, and vice versa.
And some of the patient groups that come out with us, that includes the student groups such as IFMSA, Internal Medicine Club, Neuro Society, and more. They come out, and we have a waiting area for the patients to actually get situated until we are ready for them at the basic screening part. And lots of students are eager to talk and address the problems that are prevalent on the island here, especially with diabetes and hypertension. But obesity is on the rise, and a lot of the student groups are stressing the importance of nutritional requirements and meal portions, and other things like sexual health, especially HIV and AIDS. IFMSA SCORE, I believe, offers condoms to the public just so that they can start practicing safe sexual encounters. And also, we've noticed that lots of males have come out to the community health fairs and asked if we do prostate screening. And we know that after a certain age of 40, you are more prone to develop changes in the prostate, whether it's a benign prostatic hyperplasia or carcinoma. The males also are very concerned just because they have family members die from prostate cancer. And so, unfortunately, we can't offer that service just because we have a lack of privacy setting in those areas. But we would like to work on for a chance to hopefully bring that to the community members, whether we can refer them to a more private setting or actually have better facilities for that to happen. Because we know with the women in medicine, they're able to set up space for the females to actually do breast screening. So we would like to bring another opportunity for males to be included as well, so everyone is taken care of. Other things that other student groups have brought as well are the dental health hygiene initiative, where they've purchased toothbrushes, toothpaste, just to get people aware of what proper hygiene should be. And other things would include mosquito prevention, rabies prevention. Like Elon said, whenever we have a patient come by, we ask them if they have any pets, just because we know that zoonoses are prevalent here as well. We want to stay on top of any diseases that might be transmissible from their pet to the human. So we want to protect both groups. Yeah.
And one thing I like to point out is the spay and neuter that we like to emphasize, in addition to flea and tick prevention and heartworm prevention. Overall, as you can see from the list, there's a bit of crossover as far as topics discussed. So mosquito prevention, not just for humans, but for animals as well, because heartworm disease it's a terrible thing for them to have to go through. They'll die from it if not treated, or if they catch it in time, the treatment is not pleasant. It's not a pleasant experience. For nutritional requirements for humans, we do the same for animals. We let them know, the best diet, the proportions, everything like that to avoid obesity, and also if they're undernourished, how to get them on where they're supposed to be. It's not just, as far as animal species, it's not just dogs and cats. Of course, dogs are the #1 animal we see, but it's not just dogs and cats. We encourage them to bring their goats, their sheep as well. I don't think they've brought anything larger than that. But these animals are very important to Grenadians out here, as they rely on them for a livelihood. So it's not just your dogs and cats. We tend to open up the door to other animal species to get them checked on, and even if they don't bring them, but just to say, hey, if you have goat at home or even a cow, let us know what concerns you have, and we can talk to you about that. And it's nothing to be taken lightly. I mean, these, like as I've said, these people rely on these animals for livelihood, for economic reasons, etc. So it's important that we give them everything that we can while they're there, and just make the most of this opportunity to educate.
Okay. And we just want to share a couple of pictures with you. This one is from a health fair at St. Mark's, which is the northwestern part of the island. We usually set up under these tents here, and then we share the spaces with the other groups. We use the resources that the school provides, or whichever NGO or church group or other association that we're working with. That space, whatever that space gives us, we'll work with. So this one is the waiting area. We do have quite a few patients here waiting and talking to some of our students, some of these student education groups. Here, just another image of our health fairs. So here up front we have the patient intake, where we start with the history. This man here is Dr. Subarao. He's one of our advisor and the starter of the medical human health fairs since 1994. Here we have again some nursing students in the back here helping with the blood glucose intake. And
okay, and as you see here, we have someone being very creative as far as how they transport their animals to these fairs. So not everyone is able to get, say the standard crate that we're used to seeing as far as being able to transport dogs and cats, but they do what they can, and that's very important, along with the fact that it's important that they actually come. So by any means necessary. This lovely lady here, her name is Kathy Ann. She is just a primary example of community involvement, community support, which is extremely important. These clinics, they really need the help of the community to get things going as far as location, just helping to set up anything that they can do to aid.
Okay, and here's just an image showing the patients after they've visited our basic screening area. What we have is a student doctor program where we select about 12 people of our Term 5 medical students at SGU to participate at this part where they actually get to see the patient and follow up with the clinical tutor that's they're paired with. And basically, this is an opportunity for both the student and the community member to work together. What we learn in Term 4 and Term 5 of medical school are basic focused exams on general head-to-toe examination. And so I was able to actually partake in that just a couple of weeks ago at our last health fair. I was actually able to see a patient who at first had a worry about this bump on his head, which had been growing for a couple months. But he had other things happening where his abdomen area started hurting. He wasn't drinking a lot of water, and we went on for over half an hour just talking about what's going on in his life. He's a bus driver or a truck driver who just drives around the island pretty often, and he doesn't really eat well. He doesn't stay on schedule. He doesn't sleep well. He doesn't drink a lot of water. And so when we got into one of those private spaces to actually do the physical exam, we found like a little ulcer in his epigastric area. And he wasn't really concerned with that just because he wasn't aware of what that could be. But then we actually got to apply our patient history taking skills and found out like this pain happens just after eating, epigastric pain, peptic ulcer, or like trying to differentiate which is which. And so doing that full exam and participating in that aspect was a great experience for me as a student. And for the patient himself, he was more alert afterwards, after that talk, after seeing that we actually cared about his health as well. He was much more aware of what was going on. And what was amazing was when he was leaving, he actually ran towards the water fountain and like just quickly drank lots of water. And he promised me, like, I'm going to drink water. I have a container. I will fill it up. And like hopefully he followed up on that. But like it was great to just see him run towards that water fountain. Just one of the stories that I wanted to share to show everyone that it does make an impact, even though we can't do as much as some other people might think we should. Just talking to these people, I feel, is a great important deed to do. And just more pictures for us to share with you. Again, we are using community spaces. It can look a little shabby, but we try to work with what we can. We use these spaces to try to accommodate different groups of people from different parishes to hopefully offer this opportunity for people to come out. And so this is one of the tents for
one of the tents for the veterinary side. So one of the important things as far as picking a location is making sure that we have adequate tents, not just to shield from the heat for people, but for the animals as well, to avoid risk of overheating, and that's very important. So as Judy mentioned, sometimes the locations and what we have to work with is not what you would say ideal, but we do what we can, and the community members and the patients who are participating are just very excited, and they're very appreciative of what we do. And as long as we focus on our goal as far as client education and making sure that patients, both humans and animals, are taken care of within our scope, then that's all that matters at the end of the day. Again, it's just another picture showing you that it's not just for cats and dogs. It's whatever kind of animals people can bring to the clinics. And again, restraining to a car, you do what you can. So as far as fundraisers that I mentioned before, those are key to getting these clinics going and allowing us to be able to do what we can with medical supplies, etc. So all the proceeds go to like I said, the veterinary supplies. And some of the fundraisers that we hold are waffle fundraisers, and we will actually partner up with a local restaurant that's close to the school. And there's the wine tasting events that I mentioned earlier. We often do t-shirt fundraisers. So this is a great way to get students involved, utilizing their artistic skills to draft, nice little sketches for our t-shirts, and then we vote at the end, and we broadcast it as much as possible and have students purchase these shirts, and again, it's all going towards these health fairs. And recently, the Veterinary Public Health Committee put out a wish list on Amazon for, one health, one medicine supplies. So I think that was pretty creative as well. And of course, we have our bake sales. They go on all throughout the term, trying to meet as many initiatives as possible.
And just to talk about how we've worked together, the medical students can't say enough for how much the veterinary students have done. I know we're pretty occupied with our part of academics, but veterinary students have been incredible with going out to community, passing out flyers, addressing certain community organization leaders to hopefully work with us in the future as well. They've been great with going on radio to just promote these events that we try to hold, and a lot of that stems from the physicians that also help out with the veterinary side. They're more in tune with who to talk to, where to go, and part of the integration of services with selecting different locations is we have to pick a space that works for both humans and animals. And so these spaces need to be large enough. It needs to have an outdoor space. And so a lot of times in selecting these areas, and especially new areas, we're unaware of what the population of animals and humans are at certain areas. And that becomes a difficulty in the sense that certain health fairs have better turnout for the medical side, or some health fairs have better turnout for the veterinary side. And most of the time we try to find an equal opportunity place for that to happen, but really depends on where we go. But we do try to reach out to different parishes on the island to hopefully see everyone, and hopefully give the chance for people to come out and meet with us.
Right.
So.
And one of the biggest things as far as integration of services is the discussion of zoonotic diseases. So that's something that medical students can do, and this is something that veterinary students can do. And once they're hearing it on both ends, then it helps to reinforce certain concepts, ideas, threats of these zoonotic diseases, and it helps to reinforce the fact that this is a serious thing. You really have to, well, not only do we educate them and make them aware of these things, but I guess the most important thing is letting them know what preventive measures they can take, so that they won't actually contract these diseases, or they won't become exposed, which is very important, because prevention is better than cure.
So with the past couple of health fairs and interacting with the people that come out, we have learned that many are concerned about their vision, and we've tried to talk about their lifestyle changes in terms of getting more exercise, eating better, drinking less soda, or just drinking more water in general. We find that lots of people aren't hydrating themselves enough, especially in Grenada, and they're outdoors very often. They're not aware that they need to hydrate themselves. So a lot of times when we check their blood pressure, it's through the roof, and we're like surprised that this person is sitting right in front of us. There was one health fair, I believe, earlier this January or February. We went out, and 5 people had 200 something, over 100 something blood pressure, and we're just like, this is terrible. What do we do? So we can't do as much as we can in those settings, but we were able to help them get to the hospital, and that's one of the biggest problems of these northern parishes. Lots of people aren't able to reach these community health centers or the hospital, or they just don't think it's important enough to take care of their own health in those areas. And so when we talk to the members that come out, they're ecstatic about us being here. They ask when we're coming back the next time, just because they want to see us students who are aspiring to become doctors, see them, talk to them, and just it's more accessible to them. It's right, like, I don't know, a couple blocks away from their homes, and it's just an easy walk for them to come over.
And to kind of add to what Judy mentioned, so there is a Facebook page. It's called One Health, One Medicine SGU Clinics, and we try to get that out there because obviously Facebook is a huge medium for communication. So I find that a lot of people will throw in the comments, hey, can you come to this area? We really need you here. We need you here. And the response is usually, we would love to, but we need more requests from the community members, because once there's a certain number of requests, then it's like, okay, here, this is a huge part, you know, as opposed to say maybe 3 or 4 people asking about this one particular area. We need more and more and more to make it, I hate to say worth our while, but of course, because the resources are limited and it takes a lot to get this done, we have to make sure that we are going to impact a lot of people at once. So once there's an overwhelming cry, please come here, then we will look into it. And then, of course, the Ministry of Health is involved. We have to get their clearance and find the location that's suitable. So it takes a lot of work, but that is why it's so important for communities to really get involved. Of course, we need to let them know that these things are going on. That's very important. And then once they're vocally active, then that will get the ball rolling.
So here's some of the challenges with the health fairs that we've come across. A lot of the complaints that come from the members are the long wait times that we have. So these health fairs usually run from 10 a.m. to around 1 or 2 p.m. The students leave the school in the morning around 8 a.m. We get there, we set up, and we close the health fairs around 1:30 or so. But we have long wait lines for patients to actually be seen. And on average, we would see about 60 to 80 patients. In some areas, it can go up to 90, especially in the northern parts. A couple times we've stayed there past 5, 6, just to hopefully see everyone. And that's an entire event, and that entire day taken over by the event. And so it is important to try to reach out to the community to have a more sustainable workforce, I guess, because us students were involved in these events, but we also need to study. When we plan these events, it's difficult in the sense where we try to give an equal opportunity to all semesters, and it really depends on their schedule. Another thing is, due to the varying locations that we work with, the privacy settings that we're able to offer vary. We're usually given a classroom, and we have to basically divide that up into patient rooms, or just pop-up patient rooms. And we can use screens that are provided by the school, but again, it's a limited resource, so many times we have to use these bed sheets as curtains, which aren't as professional as we want it to be. And we want these clinics to be similar to what they're able to get at these community health centers. And because we're not able to do that, we feel, a little bad about that. But we are trying to work on making new screens and more to hopefully create that setting.
So for me, I would say some challenges that we tend to see are that of cultural ones. So when you're, again, communicating with the client, we have to be open, and I'm going to speak specifically for the veterinary side, to the fact that a lot of people will use alternative methods to treat certain conditions. And to them, what they know. And so if, for example, if we suspect an internal parasitic infection and we say, okay, this is the medication that you must give, and they say, well, actually, I can give papaya seeds or something like that, right? This is what I know. I've heard of my neighbors using this. You know, we grew up giving this to the animals to help get rid of the worms. You know, if a student says, well, no, you have to give this, you know, there goes your breakdown in communication right there. There goes a breakdown in trust, and the relationship is just kind of damaged. And I say that because it's important that we are aware of these things. We have to be aware of what they use as alternatives, and it would be in our best interest as students to just keep abreast of this information, to be able to communicate with them, so we can say, you know what, yes, I've looked into that, and that's actually not a bad idea. On the flip side, you can also use this. It may be a better treatment plan for them. It may treat the parasite infection much faster, and things like that. So it's important to know what's going on. Excuse me. It's important to not shut them down just because we may not be aware of these alternative treatments, or we may not believe in it. If we know enough to say, well, that's not the healthiest thing, then we have to be careful with how we communicate that as well, because we don't want to seem like we are above anyone as far as knowledge or anything like that. And that is very, very critical, regardless of whatever country you're operating in. So that's, like I said, that's extremely critical. Other issues I would say are following up with patients. So if you have a patient coming in with a dog that has, say, I don't know, an abscess or something, and we do what we can, of course, it would be basic, you know, minimal treatment, but it's enough for them to leave happy, or at least in a better condition than when they first came in. You know, okay, so at that point we'll say, well, it's in the dog's best interest to have him seen, you know, by, say, the SGU clinic, which is our small animal clinic on the island, or, you know, contact a local veterinarian. They tend to travel, okay, to get this rectified further. If that's not done, we don't know. If it's done, we don't know, and it would be nice to follow up to make sure that you know, if they need any help as far as finding a local veterinarian, if they need any help with anything, we would love to be able to do that. So we're trying to figure out ways to offer that service, that follow-up service, so that way they're not just coming and getting the vaccines and then just leaving. Because another thing we have to think about with vaccines is vaccine reaction. So if there is a reaction to the vaccines, do we know that? No. And then we have the client walking away saying, see, this is why I never should have gotten my dog vaccinated. You know, what am I supposed to do now? And then they'll probably never go back and get vaccines, say, against rabies, which is very important. So follow up with patients is critical, and we just have to figure out a way to streamline that process. And yeah, that pretty much wraps up our presentation. Of course, we are opening the floor right now to questions, but most importantly to any suggestions that you guys may have to help us out, because there's always room for improvement. This initiative is still fairly new, and SGU will be up and running for many, many years to come. So we're hoping that this can be passed along term by term by term. So if you guys, you know, are listening and say, well, you know what, I think if they were to do this and, you know, you probably get better results, then by all means, we're open to anything you guys have to say.
Thank you. Thank you very much. I particularly appreciate the emotions and the experiences, as well as part of your experience in the One Health, One Medicine clinic. I have certainly also participated in these clinics, and it's always a pleasure just entering into the different locations and seeing a mixture of people within each community and their animals as well. And what is particularly interesting about this is that the type of social cohesiveness that occurs. So it's not necessarily just a health event where people themselves can seek care together with their animals, but it's also a social interaction. It's interaction within the community context. It's also interaction with our team and the community at the same time. So all in all, it's usually a Saturday well spent. And it's particularly relevant to communities where there is limitations in the basket of services that they have access to. So I believe we are fortunate in Grenada, in the various communities to receive the type of services offered by the One Health, One Medicine clinics, but also our students are also fortunate in that they are able to demonstrate and apply their medical and veterinary knowledge to the field in a small island context, but with certain applications to wherever in the world that you belong to as well. So let's open the floor. We have John with us, our online team member, and we would like to open the floor and possibly even share your comments. Can you see what our students are doing here in Grenada? Can you see that being applied within your own locality as well? Interested to find out.
Great. Yeah, thank you, Elon. Thank you, Judy, and thank you, Dr. Daisy. So at this point, yeah, we're opening up to questions. The easiest way is to type your questions in the chat box, and if you want to come on the microphone, there's a little hand icon in your GoToTraining panel. You can raise your hand, and we'll bring you on the microphone. But let's get started from the chat. So the first one, first question is that you guys as students, you only spend a short time in Grenada. So how do you keep these clinics going as students kind of come and go?
That's a very good question. So basically, with the involvement of professors, the various faculty members, we make sure that things are just passed along that way. So we may come and go, but the professors stick around, and so we make sure that information, like I said, is passed on. And usually before the last term leaves, they do a really good job at educating, the new termers to say, this is what we have. We highly encourage you to get involved as much as possible. So the more meetings we have, the more events we have, word just spreads. And for our veterinary student community, we're fairly small compared to the medical side, so word spreads fast. Again, and with the school being so supportive, we don't have to worry about anything falling to the wayside. So that's a good thing.
Yeah, and for the medical students, for ANSA, for that part. Lots of students that come out to the health fairs always come out to the next one. And so we try to recruit interested members who are interested in following up to become one of the e-board members to help put on these health fairs. And so in these past couple of semesters, it's all basically student-led. We occasionally have our advisor advise us on what we should do in terms of fundraising or donations, but it is mainly student-run. And we wouldn't be able to do this without proper leadership from our previous AMSA e-board, other student groups as well. I know they also pass on what their initiative is at the health fairs are.
I must also comment on that. From a faculty perspective, these students are driven. And when you have students that are driven, not only in terms of their training and development as medical professionals, but they're driven in terms of service. They have sufficient work to do. They have classes to attend to, they have research, they have exams, but at the same time, they do find the time. And it's not necessarily just today alone, because in any given Saturday when these health fairs are held, there's background training that needs to be done for students who are participating in these health fairs. There is coordination with community organized groups. So there's a lot of effort that's being done, but I think over the years, building that type of experience makes it a lot easier in that sense. But with the drive of our students, and we do have the population of medical students, of veterinary students, arts and sciences, public health students, it's a very complementary group that can accommodate for an event such as a One Health, One Medicine clinic as well. So we do have the right ingredients and the right initiative and ambition from our students to take on such activities.
Excellent. It leads into the second question, and the second question is, can the One Health, One Medicine health clinics that are run at St. George University be a model for where you reside, wherever that is?
Absolutely. And again, it would even be easier, so for myself coming from the States, it would be probably easier to translate this to the US, because as an American, culturally speaking, I would have no issues as far as barriers are concerned. And then you have to think about resources. I'd probably have a bit more resources available to my disposal. So that I think it would work really well.
I think it would work well for my community as well. I'm from Brooklyn, New York. We have lots of people, lots of pets. And we don't have quite the amount of other farm animals like goats and cows, but it is important to stress the importance of just taking well care of your animal. We do have some public spaces available, like Central Park or Prospect Park and things like that, which are big open areas for people to come out and meet. But it's a different idea just because the need is different. Here in Grenada, it's more based on population need, whereas in the States, in New York City, I feel it's more that people want a more private setting. They want more of an indoor enclosed area where they can speak to their physician or the veterinarian more privately to take care of the situation.
Yeah.
That's a very good point. As I've mentioned before, there's only one animal clinic on the island. Okay, and I know the island's fairly small, but just one, and it's located in St. George's. And so if you have someone who's residing in St. Patrick's, which is at the opposite side of the island, for them to drive 2 hours or however long it takes to get down here for a vet visit, that's not the easiest thing to do. They may not have transportation, and taking the bus, animals aren't allowed on the public buses either. So that's pretty tough. And so if you're going to bring this to your homeland, then you just have to think about where will the need be, and it'll be with these things in mind: accessibility, maybe poverty issues, because obviously these vaccinations, for instance, are free. The exams, everything is free. So that would be the biggest thing to take into account.
Excellent. Okay, the next question comes from Natasha, and it is, and this might be for Dr. Bedesi as well, how did One Health, One Medicine come about at SGU, and is it a current club on campus that holds the events and fundraisers?
Maybe I can first speak to that. Well, One Health, One Medicine speaks to St. George's University in terms of our structure and our function. We began as a medical school, but as time progressed, we built a School of Veterinary Medicine, graduate studies programs, arts and sciences, and the disciplines that are taught, the nature of the research that's involved, but also in terms of the work that we have to actually conduct, whether it's vector-borne diseases, whether it's looking at the issues of food safety. These are issues that transcends the professions of medicine, of veterinary medicine. On top of all of that, we have a community where medical students, veterinary students are living together. They're learning together. So these efforts will naturally progress towards working together. And that complements the whole initiative of One Health and One Medicine. So St. George's University is very strategic and positioned to actually be a leader in One Health, One Medicine because of the nature of our structure and function. From the student organizations, and both Elon and Judy can speak more to that effect, but we have many different student organizations that do have their particular focal points, but they all come together. Mm-hmm. So in terms of One Health, One Medicine, we do have concentration of persons, individuals, and student groups that are in the realm of One Health, One Medicine, but by nature of One Health, One Medicine, it does require for the medical, the veterinary, the public health students, for example, to get together. So it's not necessarily just focused on one organization, but it's a collaboration across student organizations, as we see here today with both Elon and Judy.
Mm-hmm.
As far as organizations are concerned, for the veterinary side, we have the student chapter of the American Veterinary Medical Association that's heavily involved with fundraising and just raising awareness in general. And as I've mentioned, the Veterinary Public Health Committee, which is just key behind getting these clinics going. And it's interesting that Dr. Bedesi mentioned the involvement of public health students. So I completely forgot to mention earlier that we do have another organization on campus called the Public Health Student Association. Mm-hmm. And recently we've been trying to get them involved in these home clinics as well. So the Public Health Student Association comprises of standalone students who are just getting their master's in public health. They're not a med student or a veterinary student. But then we also have med students and veterinary students who are pursuing their master's degree in public health. And so having them involved in these clinics would offer a very unique approach, right? A more well-rounded approach. We know public health to be very well-rounded. So you would have the medical side, the veterinary side, and then you have to just bring it all together, that public health key. So.
And the Public Health Student Association, we've previously participated in health fairs outside of OHAM. We've worked with the Royal Grenadian Police Force, and we've held a couple of health fairs in the past year where we attended to both the officers and their family at these locations where we can just hang out and to just socialize and tend to some of their health concerns as well. In regards to the student groups on the medical side, we have so many, just one for basically any specialty that that comes to mind. And in the efforts of collaboration, it is difficult in the part that so many students want to participate, but we're limited on space and how much they can actually do and what they can actually get out of it. So we do have sign-up sheets for things like that, but many of the organizations on campus have their own primary event. Like Dr. Berdesi mentioned, OHAM is just one of the initiatives where all of these organizations come together for, but each of these organizations do their own thing. They fundraise for different things like Cancer Society, the Psychiatric Hospital, Neuro Society, Down Syndrome Association, it's Autism Association, just various things across the island that need funding. And they find that the resources that are available to them aren't as great as what we can offer sometimes. Just because medical students, there are so many of us, we can give the manpower to them to hopefully help out in fundraising. And a lot of these fundraising comes from the big sales that happen throughout the semester. We have certain large events where we rent out a space somewhere near campus and we'll hold an event. So the Student Government Association of SGU actually holds something like Sandblast and Unity Ball, and they'll fundraise for certain events to give to these associations across the island. And one that AMSA does every year is fundraise for the Grenada Heart Association, where we fundraise a certain amount of money, we'll give it to the association, and they'll decide who to fly out for heart surgery. Usually they're children. And we've been working with them since 1995 or so. I believe, I need to double check that year, but it's been a while, and it's really due to some of the faculty members that work really closely with the students on campus.
Thank you. Yeah. So there are a few more questions in the chat box, but I'm going to switch over for a second. I do have a hand raised from Naftali, and so Naftali, if you want to try to come on the microphone, just unmute yourself, and I'll let you know if we can hear you.
Hello?
Go ahead and ask your question. Yeah, we can hear you great.
Yeah, how are you doing? My name is Naftali Remy, and I just graduated last month, so I plan on attending SGU in the fall. So I don't know if this question was already mentioned, but when exactly can you start the clinical volunteer work in the medical curriculum?
That's a great question. So I started ever since I got on the island, and so we have organization fairs at the beginning of the semester. Come out to those and you'll basically be able to speak to anyone from any part of the organization. Many of the organizations attend health fair clinics, so depending on your interest, you can join one of those groups to attend one of these health fairs. We usually have 3 health fairs per semester. The veterinary side, we have 2 health fairs together. And so basically, whenever you get on the island, reach out to one of us at the organization health fairs, or just message us at the One Health, One Medicine event page, or you can find AMSA, you can find my name, Judy Wong, to discuss any opportunities you might be interested in.
And as part of the orientation as well, so before your classes begin, you will have orientation exercises, and these orientations will orient you to all facets of campus life, including student organizations, and the different options that you have to participate in.
I see. All right, thank you.
Sure.
Thank you, guys. All right, so I'm going to go back to the chat box. Again, feel free to type your questions in the chat, or you can raise your hand. I'm going to skip down one, and then I've got a series of questions for Dr. Badesi that came in. This question comes from Oram, who's in Nigeria, and the question is, for those of us that come from communities where there is no good relationship between the vets and the medics, he's talking about Nigeria, how are we supposed to go about it? Because it seems that only the veterinarians are clamoring and promoting the One Health in Nigeria, and presumably not the medics, and we're finding difficulties.
Very good question.
Would you like to start?
By all means,
Piggyback?
you guys go ahead.
Okay. Wow. Okay. So I know that's definitely not a unique situation, first of all. I think it would be important if you guys would take baby steps and just try to organize meetings and start discussing. Also, putting together like newsletters that will address issues that have, like concerning zoonotic diseases. I think that would be very important. And at these meetings, yes, if you just find one common thread to tie it together, and in my opinion, it is the idea of zoonoses. That is the most important thing, because once you can once again emphasize to people, okay, this disease seen in livestock, right? So for example, Campylobacter, I'll never forget, and this is actually what drew me to public health. I first learned about this this issue when I was an undergrad, and it was a huge outbreak in Kenya in their livestock, in their cattle, and it was wiping them out. And as a result, it was affecting farmers, and as a result, it was affecting their livelihood because they rely on them. They have families to take care of, et cetera, et cetera. So not only was that side impacted, but these people were now contracting the bacteria, and they were getting sick. So if they don't have proper access to health care or even the funds now that their cattle are dying out, then what happens? So if you can do things like that to say, listen, what's going on with your cattle? Well, at the end affect you, and then let's just look at the bigger picture. We're looking at, say, the community in, say, a community in Nigeria. If you're having all these issues, it's going to become now a burden on the health system. Resources may or may not be limited depending on where you are, etc. So those are the things I think that you should be starting to talk about. Just get conversation going, get some traction going. The newsletters, Facebook is now a huge, very popular tool with communicating. If you can start a page and just, get things going, post, and advertise it as much as possible. Eventually, things will pick up. People will become more and more interested. So I think that would be a great way to start.
My question is, are there public health officials that work in pretty close relationships with the veterinary side? Just because I think that public health is a great connection with the medical and the veterinary aspect of health. I myself, just going into the Master of Public Health, I learned quite a lot of what is actually shared between medical and veterinary side. And I think the job of these public health officials is to connect both parts. And I'm pretty sure Nigeria has a really good public health system where they're...
It does,
right?
but at the same time, it does in the population centers, but also in the rural setting, sometimes it's tricky.
Yeah.
I'll be honest with you, there are parts of the world where the closest a person have gotten to a healthcare provider is a veterinarian.
Mm-hmm.
Because they are the ones who tend to be more out in the rural settings, attending to their animals.
Mm-hmm.
Physicians it's few and far between. So for some communities, the veterinarians are their primary healthcare provider.
Right.
And there are situations where they're acting at capacity as well. So when we think about the linkage of animals and humans from the agricultural context and the wildlife context, it's the veterinarians that are more involved in that. Now, what I particularly appreciate about you guys and sharing this experience with the Green context is, while the effort is being driven by our students, we also have co-partnership with the communities. So here you have an effort where the community has bought into it, and they are the ones that are clamoring for it. The professionals, whether it's the veterinarians, whether it's the physicians, they may have their own disconnect initially, at least. But once they see the demonstration, and once the community demands it, then it's for the professionals to then respond accordingly. So while we may have some disconnect, and even in settings of, let's say, developed country context, we have professions, and the professions sometimes have difficulty even speaking to each other, and that occurs across all professions. It's a silo effect. We're trained and specialized in our own niches, and it's difficult to see eye to eye with each other. But from the health of a community perspective, they don't see the differences. What they see is what's real to them. What's real to them are the diseases that's being shared between humans and animals. So once you can lobby and develop that community-based approach, then the professions will in fact respond accordingly.
Sorry about the typing, guys. Okay, so it looks like Orem has his hand up, and Orem, if you unmute yourself, looks like you might have a follow-up question. There should be a microphone icon somewhere around your Go to Training panel, or you having any trouble, Orem? You can also type the follow-up question. I'll give you a couple more seconds, and then I'll get to another chat. Oh, there we go.
Okay, thank you very much.
There you are.
This is Orem from Nigeria.
Welcome, Orem. Go ahead.
Actually, my question. Okay, the first question was actually answered. Just like she said, we need to actually do some news letters and try to orient ourselves. Now, the question here is, just like I said earlier, we are not actually coming together with the vet. I'm a vet. I just graduated freshly from the University of Nigeria, and I came in for a master. Not actually cooperating with the veterinarians. In the university where I'm doing my master's now, they were about to introduce the One Health Medicine Masters. And to be sincere, the medics actually kicked against it. And up till now, it is down. Now, some of us has gone into epizootheology, which was introduced by the university. Now, my question is epizootheology has to do with One Health? Because some scholars were arguing that it does not support One Health medicine in context. So I want to know epizootheology. Thank you.
I'm sure. Well, let me first of all say epizootheology has its foundation in epidemiology. And when we think about epidemiology, it's a science. It's a discipline which looks at the distribution and the determinants of diseases in any given population. There is no distinction in what diseases, and there is no differentiation in terms of populations. Even before epidemiology became a discipline, we had the principle of herd health. And herd health, in terms of how health impacts a population, was derived from understanding the dynamics of health within the herd of animals. So this whole aspect of population health that evolved from herd health, and now epidemiology and epizootheology, has its genesis of understanding disease burdens across the species of humans and animals. So it is difficult from a theoretical perspective to even create a separation. I can understand sometimes, though, in a practical context, there may be separation, depends on, however, your background, your training. If I'm trained in a certain way, then I am sort of limited within the context of my training. I'll tell you, for example, both Judy and Elon, yes, they are medical students and they're veterinary students, but they have a collective consciousness as it relates to public health. So they can make that linkage. So by the practice of epizootheology, it does not allow for or should not allow for any type of differentiation between looking at disease burdens from humans versus animals. Having said that, though, it sometimes depends on maybe where it's located. If it's located in a school of medicine, that may carry its inherent biases sometimes as well.
Okay, thank you very much. I really appreciate it.
Thanks, everyone. So there's one more kind of longer question in the chat box, and it's first for Dr. Bedesi. And it comes from a combination of Natasha and Jessica. And it is...
These guys are going for me.
So how did Dr. Bedesi decide to become both a medical doctor and a veterinary doctor? How do you practice both veterinary and medical studies? And how can a student be prepared for both?
Okay, well, thank you for your question. But first of all, clarification, I'm not a medical doctor. I'm a veterinarian by training. But in that training, though, and maybe that's where I can probably share with you my passion and also my ability to interconnect the human and veterinary side. When I pursued my veterinary training, for the first 18 months, I spent my training together with medical students, together with nursing students, pharmacy students, and dentistry students. So we learned anatomy from gross, histology, embryology. We learned biochemistry, physiology together, the basic principles. We engaged problem-based learning, discussing cases that occurred across both the human, the veterinary, the pharmacy, the dental, the nursing areas. So that type of foundation encouraged, one, my shared respect and understanding for various disciplines across the health sciences, and further see the value in bringing our minds, bringing our skills together into the solving problems. And over the years, we have had multiple examples, whether it's the avian influenza, whether it's influenza type A H1N1, whether it's the Ebola, whether it's chikungunya, whether it's Zika, whether it's regular foodborne diseases. We have multiple opportunities where we need to come together. So that type of context and residing here at St. George's University comes natural. I am able to work both in the School of Medicine and in the School of Veterinary Medicine. We have students that we share teaching, learning, and research experiences with it. So it's a combination of my training background, but it's more the ability to operationalize the collaborative education and research and practice that enables us all to actively pursue the One Health, One Medicine approach. Hope that's helpful.
Yeah, thank you. So that ends. I believe that wraps up the questions that are in the chat box. So, Dr. Bedez, do you want to kind of close out the session?
Sure. I would just like to maybe ask Elon and Judy, now that you are very much been indoctrinated into the practice and principles of One Health, One Medicine, eventually, though, you're going to leave Grenada. You're going to head into a clinical training in hospital settings, whether it's veterinary or human medical settings. Then you're moving on to post-medical training, residency programs, practice settings, etc. Is this experience in One Health, One Medicine one where you see yourselves continuing to carry into your respective clinical disciplines going forward?
You want to go first? Go ahead.
Definitely, yeah. But my question is, I don't know where to go from here, just because back home is a little different thing. And I'm not the biggest fan of animals, to be honest, but like I am learning more about animals each day. After meeting Alon yesterday, I found out transmissible venereal tumors were a thing. I didn't know. So I looked it up and I was like, oh, there's 4 types of tumors that can be transmitted between animals. Go figure. But, so like in that aspect, I think that's really interesting in the sense that diseases are always evolving, and just one day something can be introduced into the human population. And so I think in terms of incorporating that knowledge is important, and sharing that with the community members, making them more aware of what is around them, in terms of keeping their animals safe, well kept, hygienic practices, well kept, and even at home with the new uprise of Powassan tick bites in New York area. That's also a connection between both fields, and I think it's important to just stay on top of the knowledge that's always being introduced. And so in that sense, I do think I will continue with these initiatives and learning so much with just by being with veterinary students and going out to community and sharing the same initiative. I think it's a great experience to just bring forward in the future.
Same here. But for me, there's just a frustration in that there's so many things to do. I see that getting my degree in public health has opened up my eyes to so many things, and just hearing about. I'm sorry, I forgot your name, but you reside in Nigeria, and you were talking about the frustrations that you have with bringing the fields together, etc. Here I am sitting here saying, man, if only I could go to Nigeria, what impacts could I make? Things like that. So it's just, when I'm done, I do plan on pursuing a residency in either pathology or lab animal medicine. And I want to make sure that whatever it is that I do, I still hold on to my public health ideologies and do not neglect them. And I know that there's so many things that I can do to incorporate the two, but I do want to make an impact wherever I go. I don't want to be limited to the States. I want to be able to, impact other areas that are in need as well.
Yeah, and I think that's the vision that we all should encapsulate in One Health, One Medicine. If Elon, for example, as a veterinarian, is attending to a dog, and there's signs and suspicions of the animal being infected with leptospirosis, or even skin lesions with ringworm infections, Elon got to immediately find out, well, who's your physician? That's the pet owner. Consult with the physician and indicate that here's one of your patients with their animal, which is demonstrating possible zoonotic pathogenic potential. Maybe you should have a look at your human colleague, and I will do my best in terms of treating, preventing, and controlling the animal exposure, as well as educating the owners on how best to mitigate any risk of transmission as well. If Judy, for example, is in an emergency room setting, and she sees a patient who is comatose, possibly from septicemia or septic shock, can I take a history? You may want to use broad-spectrum antibiotics, well, as you have to, but sometimes if the patient, let's say, is a pig farmer, exposed to pigs, and have injuries which might have served as site for entry of infections, then Judy needs to understand that we have to think about maybe what are the veterinary issues involved here. The veterinarian may indicate that think about Streptococcus suis specifically, and treat specifically for that as well. What about if a patient with rheumatoid arthritis keeps returning every 6 weeks with flare-ups? Do you just keep treating with anti-inflammatory drugs? What else is going on? Maybe the history will reveal that this person has a pet cockatiel bird, and every time cleans the cage, a flare-up occurs. Judy and the veterinary colleague will indicate that some of these cockatiels may transmit Cryptococcus neoformans. And if you're cleaning the cage, that organism aerosolizes, which can lead to exposure and elicit an immune and inflammatory reaction as well. So we need to treat the bird and manage the hygiene of the animal in terms of controlling and managing the patient with rheumatoid arthritis. So there are multiple avenues, and these are just examples by how these guys can actually work together, even besides their routine zoonotic diseases. At the depth of your clinical training, whether, let's say, we're thinking about a space-occupying lesion or mass, you might think it's a tumor. Sometimes it could be a parasitic cyst that's involved as well. And surgically, you need to recognize that in terms of how to manage that particular case. And these parasites are shared, many of them, between humans and animals as well. So the conversation continues. That's the point we're making, and we continue to learn. And the best way to learn is to learn and share, because the problems do not confine themselves to any particular criteria. These diseases are complicated. The determinants are multifactorial, but the solutions require that multidisciplinary approach. And hopefully this is what we are about here in terms of our course, One World, One Health, One Medicine, as we continue to explore how we can most effectively address the health challenges we face with, recognizing the interdependency interactions between that of humans, animals, and the environment. Well, I think it was a wonderful session. to thank both Judy and Elon for their time, their effort, and expertise in sharing their experiences in our One Health, One Medicine clinics. I trust that you found the session enlightening at the same time, and we look forward to sharing our next installment of our seminar series in the month of July. Well, it's happy summertime or winter, depending on where you are. Please do not forget, if you have not registered for the course just yet, register, enroll at online.sgu.edu/anniversary, where you can engage our previous monthly seminars, participate in discussion forum, maybe answer a little quiz, and have the opportunity as well to gain continued professional development credits as part of your participation. Well, until another time, thank you, John, and our online team, and it's goodbye for now.
Thanks, Dr. Daisy. Thanks, Elon. Thanks, Judy.
Yeah, that's good.
Great.